All right, I think now is a good time as any to get started. So thank you for joining us on this Wednesday morning or Wednesday afternoon, depending on where you're joining us from. You have made it to the Systems for Action Research and Progress webinar series. This is a series that we host about every 2 weeks where we're featuring different research projects that are happening through the Systems for Action research program to come and provide some rapid updates on their research and what is happening sort of in live time. So today you're going to be hearing from one of our newer grantees that was funded from a research call for proposals that we released through the Robert Wood Johnson Foundation in early 2024. This team was awarded a pilot award, so they're with us for 12 months to do some really fantastic pilot study activities on systems alignment for effective resettlement, engaging refugee-led organizations and refugee voices to advance health equity and refugee settlement. But you probably already knew that because you registered for this webinar and you have shown up. So you have made it to the right place and welcome. My name is Carrington Lott, and I'm the Deputy Director at Systems for Action. And if you're not familiar with Systems for Action, as I alluded to earlier, we are a national research program office funded by the Robert Wood Johnson Foundation. And we have lots of activities that we do as a program office, but the main one that we participate in is developing and releasing calls for proposals. And we typically do this on an annual basis. We just released a new call for proposals last week on January 15th. I believe my colleague Sadina Belmashkin is going to put the link to learn more information about this particular funding opportunity in the chat, so definitely be looking out for that. This particular call for proposals is called Community-Led Systems Research to Address Systemic Racism. So we are looking to fund new research that is community-led and our pilot test studies that test the feasibility of new interventions designed to dismantle and disrupt forms of systemic racism. So this is another pilot award for about 12 months. And this time, for this particular call for funding, this is the first time we've done this. One of the requirements is that the lead applicant must be from a community-based organization. So we're really excited to see what types of proposals we receive. And if you want to learn more information on the link that Sadina is going to post in the chat, there is information about the funding opportunity. So you can read the entire brochure and see what type of research we're looking to fund. And then you can also join us for weekly office hours and some informational webinars that are coming up. So back to today's session, we're here at the agenda. I'm providing just a really quick welcome, and then I'll hand it over to the team from American Institutes for Research. They are going to tell you what they have planned during their 12 months for their Systems for Action research project. And then Susanna Lepley, who is one of their partners in the research project, is going to provide some important commentary on the importance of this research and how it's impacting the community. And then we'll save some time for Q&A. So if you have any questions that come up along the way, please locate the Q&A box at the bottom of your Zoom screen. Pop your question in there, and we'll make sure that we save time for it at the end of the presentation and commentary. And then my last piece of housekeeping is that this session is recorded, and we will share the recording and the slides after today's session. Okay, Maliha, I believe the next slide is where you will introduce your team. So I'm going to go ahead and hand it over to you. Thank you so much for joining. And Maliha, it's all yours.
Hi, everyone. Thanks so much, Carrington. I just want to confirm if everyone can see me and hear me clearly.
I can hear you, yes.
Thanks. So it's a great pleasure to be here and to present on our work under the Robert Wood Johnson Foundation Systems for Action grant. My name is Maliha Ali. I'm the project director for this work, and I'm a senior researcher at the American Institutes for Research, where we work to generate and use rigorous evidence that contributes to a better, more equitable world. On behalf of our team, I'm really excited to share with you our work on the Systems Alignment for Effective Resettlement project. And today I'm joined by my colleagues, Danielle Igraviador and project partner, Susanna Lepley. I'll turn it to them to introduce themselves.
Thanks, Maliha. I can go first. Hi, everyone. My name is Danielle Grabudor, and I am a researcher at the American Institutes for Research, and I am the data analysis lead for this work. Thank you.
Hello, and I'm Susanna Lapley. I'm the Virginia Director for Church World Service, which is one of the 11, I believe, resettlement agencies in the country.
All right. I'm so glad you guys could join us today. So in this webinar, we will be providing an overview of our project, the progress that we've made thus far, and we'll share some preliminary findings followed by commentary by Susanna, and then we'll open it up for Q&A. So before we dig into the project, I think it may be helpful to cover some background on refugee resettlement. Refugee resettlement takes place under the U.S. Refugee Admissions Program. This is administered under the Department of State. And the United States actually has the largest refugee resettlement program in the world. Since the passage of the Refugee Act in 1980, the program has resettled over 3 million refugees in the U.S. In addition to the conventional refugee admissions process, there's also emergency initiatives and temporary programs that enable asylees and humanitarian parolee status to people that are fleeing adverse circumstances. In fact, between 2021 and mid 2023, roughly 500,000 refugees entered the US through such programs. Specifically from countries such as Afghanistan, Cuba, Nicaragua, Ukraine, and Venezuela. The photograph that you see actually shows Afghan arrivals being evacuated to the US under Operation Allies Welcome. That was one such emergency initiative in the summer of 2022. So once people enter the country with a refugee status, resettlement agencies administer numerous essential supports and services through different programs that are administered by the Office of Refugee Resettlement. Resettlement agencies interact and work with many partners to deliver these services. These include local, state, and federal organizations that are actually working across medical, social, and public health systems. So essentially, refugee resettlement is really a shared responsibility across many different organizations. And resettlement agencies are really invested in providing essential time-bound resettlement services that include assistance to find housing, food, clothing. They offer case management services to help refugees apply for Social Security cards, enroll in Medicaid, register kids for school, schedule medical appointments. They help with employment training and secure many other social supports. The timeliness of these resettlement services in a coordinated manner really contribute to many social determinants of health that are vital for refugee well-being and their integration into their new communities. So this particular Systems for Action grant really asked grantees to identify ways in which systems alignment can address systemic racism. And certainly the structural barriers within the systems that are involved in resettlement efforts, such as public health, social services, these can really create hurdles to effective resettlement and integration. And so to really refresh our memories of what is systemic racism, this is something that exists through laws, policies, practices, beliefs, and attitudes that produce and perpetuate widespread and unfair treatment of specific groups of people. And oftentimes, the term systemic racism is used interchangeably with structural racism because it's the structure of laws, policies, and practices that guide these systems and provide the scaffolding for systems to function as they do. So what does this look like for refugees? What do we know about what structural racism looks like in the resettlement space? Well, the literature specifically on how structural racism manifests for refugees is slim at best, but what we can do is apply conceptual models such as the one that you see here, Hardiman's conceptual model, to get some sense of what the manifestations of structural barriers on refugee resettlement can look like. So refugees can be actually vulnerable to all forms of racism, interpersonal, internalized, and systemic or structural. And moreover, these different forms of racism don't really exist in isolation from each other. If you think about it on the community level, it could include rhetoric such as statements and beliefs that refugees are an economic burden, It can also include exclusionary or bureaucratic practices that govern systems that are offering resettlement services and benefits. So depicted on the far right of this conceptual model, it manifests as institutional policies that could influence communication failures that refugees experience when receiving services, or differential treatment at points of service delivery, the lack of resources and policies that are really designed to serve refugees effectively. And each of these can then result in barriers to needed care and opportunities that are offered as part of refugee resettlement services. So to give you a few examples, when you think about structural barriers in refugee resettlement, this can look like maybe system level delays in documentation renewals. That could lead to the invalidation of work permits, driver's licenses. It could threaten refugees' ability to work, their livelihood. Another example is related to housing. So in addition to rising rent costs, housing discrimination against refugees could really hamper resettlement providers' efforts to provide housing. And we know that while interpreters are increasingly available to support refugees with doctors' visits, in the absence of accurate and culturally competent interpretation, refugees can experience communication gaps, and that can, contribute to increased hesitancy in accessing behavioral health services. So there's really a need for greater cultural and linguistic competence in the provision of care. So those are just a few examples of what structural barriers can look like. Let's listen to one such account from the refugee perspective to get a better sense of it.
Know the language, so they will face lots of problems. It's starting from housing, healthcare, education, transportation, or opening bank account. The main problem that the newcomers are facing in Virginia is the term and condition with leasing offices. So if you do not have anyone here from your relatives to support you, to go with you, and to rent a house for you, so you will be stuck and you will not be able to find a house for you even for 6 months. Because the leasing agency, they are asking about your credit, your work, your agreement, your money, your background, and you have nothing.
So I think listening to this account really helps us realize that there are numerous ways in which structural barriers then in turn, create a catch-22 situation for refugees. Now, despite the challenges posed by structural barriers to resettlement efforts, the system representatives who are actually engaged in resettlement often fail to identify these barriers, mainly because these are upstream and really embedded in how the policies and programs operate, while resettlement providers are working downstream, which is like more on direct service provision. So that leads us to wonder, could better systems alignment enable resettlement partners to help identify and address these structural barriers that really get in the way of doing resettlement effectively? And that's exactly what we're trying to do in this project by leveraging an existing federal coordinating mechanism that's known as quarterly consultations. So quarterly consultations bring together numerous organizations that represent various systems, including government, public health, healthcare, social services. And these meetings that are mandated under the resettlement system inform and it helps inform all of these resettlement partners about expected refugee arrivals. It enables them to really examine local capacity to receive them and then solicit input from different representatives about, what are the solutions that we need to start thinking about? What are the services that we need to start preparing about? In Virginia, these consultations are actually implemented as the Virginia Community Capacity Initiative, or VCCI. And based on our conversations with partners and early findings from this work, there are numerous opportunities to improve these consultations to better align the systems that are involved in resettlement. So for instance, through meaningful two-way communication approaches, building capacity for collective action, and particularly looking upstream at figuring out what are the hurdles or the structural barriers that are preventing us from doing our work effectively. So our project is a 12-month developmental study that started in September of last year. And through this, we are creating and assessing a novel systems alignment approach to improve how quarterly consultations can fully achieve their purpose and thereby improve the health and well-being of refugees as they resettle and integrate in Virginia. The work involves formative research through which we will examine Virginia's quarterly consultation process and then create an alignment strategy that will help the government, social service, public health system representatives to better work together. This study is really geared also towards enabling or bringing in the community voice, enabling refugees and refugee-led organizations to engage with medical, public health, and social system representatives in the development of the approach. So how will we do this? So developing the approach will be informed by research that really helps us answer the question, what does systems alignment look like in the VCCI? And then really determine what could systems alignment look like in a way that addresses structural barriers and is inclusive of refugees. The project engages an advisory panel in all aspects of the work to really ensure that the design of the alignment approach is based on the experience of the people and really the VCCI representatives that will use the approach. So core to this work is the advisory panel. We have important partners who serve on this that represent the different systems, organizations, and community and individuals that really are engaged in VCCI. I'll talk a little more about that in our next slide, but just to give you a sense of the role of the advisory panel, they will be engaged in all aspects of the study, including the research, which falls under AIM 1. It's our formative research, and through this, we are going to be observing VCCI meetings. We have planned for data collection with a listening session and key informant interviews with people who actually attend VCCI meetings. Secondly, the advisory panel will be involved closely in designing and assessing the alignment approach. And then finally, we will engage them in assessing the feasibility of the approach. So here are the 6 members of the advisory panel. Like I mentioned, it's really core to this work, and they all represent the different systems we seek to align. We have important partners who are serving on this, including the Office of New Americans. We have the State Refugee Resettlement Coordinator. We also have the Virginia State Refugee Health Coordinator, Jill Grumbine. Sayum Burhe is the State Refugee Resettlement Coordinator. We have Susanna from Church World Service representing a resettlement agency. We also have Neela Yousafzai, who is the president of Fresh Start Refugee Assistance Center. That is a refugee-led not-for-profit organization. And we have 2 newcomers that represent the lived experience of refugees. We're really grateful to their role and participation on this project. The advisory panel will help in really co-developing the systems alignment approach, and we will be applying human-centered design principles in the process. So without going into too much detail, human-centered design is really an iterative approach that involves observing, engaging with, and really trying to empathize with the users of a product or service to understand their priorities and concerns, and then use that in designing the approach. So with that overview of the background and project goals and design, I'm going to turn it over to my colleague Danielle, who will share more about our progress thus far and preliminary findings.
Thanks, Maliha. So here's the status of our progress so far. We have completed 11 quarterly consultation meeting observations. 8 were in Virginia, which were all virtual, 2 in North Carolina, which were also virtual, and 1 in Maryland, which we attended in person. What we observed were concepts of systems alignment in relation to the VCCI meetings, including operation, structure, and function, participant attendance and engagement, capacity for joint action, meaning shared purpose, shared governance, and shared data, as well as the kinds of structural barriers to resettlement that were brought up in the meetings. In parallel, we did a listening session with advisory board panelists who lent their expertise and lived experience. This allowed us to confirm or clarify our observations, which we shared with them, identified opportunities for improvement, and helped them hear from one another and exchange different perspectives. For the key informant interviews, we have conducted 2 out of 3 that we have planned, and these interviews are with attendees that represent different systems on the VCCI meetings. On these interviews, we have been digging deeper into the structural barriers to resettlement for both refugees and VCCI members. Next slide, please, Leah. Thank you. And then in terms of our preliminary findings for system alignment and thinking about capacity for joint action, there is a sense of shared purpose. The way that the meetings are set up enables and reflects a shared purpose. There is shared data in terms of report outs, expectations of arrivals, what organizations are experiencing on the ground, and their capacity to deliver services. For shared finance, people aren't literally sharing finances from what we've heard and observed, but when organizations describe their programs and if they have additional capacity for more clients, they often volunteer their services for others. For shared governance, the way the term is technically described, we didn't have a sense of shared governance, but there is a sense of shared ownership to figure out challenges such as the way resettlement agencies work with the State Refugee Office. For participation, the attendance and engagement, there is representation from schools, healthcare, public health, resettlement agencies, as well as community-based organizations, but there is a desired attendance more frequently for public safety and local government. For engaging refugee voice, refugee participation is represented by resettlement agencies when they're sharing their challenges resettling refugees, but refugees are not present in the quarterly consultations. It has been discussed again in our observations and listening sessions and KIIs that there could be value for refugees to attend, but if it were built out in a way for meaningful engagement. And there are some refugee-led community-based organizations in attendance at these VCCI meetings. In terms of structural barriers, here are some of the common structural barriers that were identified across our data collection. When recognizing these challenges, people across the board noted that everyone was facing the same barriers and witnessed the same, these same experiences. And VCCI meetings enabled peer learning on how folks were troubleshooting. For example, one would say that they had a similar situation to someone experiencing a barrier or challenge, and then they would say, this was our solution. We can talk offline, and they would share their information with each other. So these are our preliminary findings so far. I'll turn it back over to Maliha, who will now discuss our next steps.
Great. Thanks, Danielle. So in terms of our next steps, now that we're almost done with our formative research, we're really getting ready to engage the advisory panel in our human-centered design process to develop the new systems alignment approach. Human-centered design often happens in 3 phases: inspiration, ideation, and implementation. We are currently in the inspiration phase, which really aligns with what we're doing under AIM-1. And we will be meeting with the advisory panel to review the formative research findings and really assess on what we've learned about opportunities to improve quarterly consultations. That's going to set us up for the ideation phase, where we will brainstorm specific solutions informed by the research findings. And that's the bulk of AIM-2, where we will develop the alignment strategy. And next, we'll get into implementation. This is AIM-3, where we get to test out and refine the prototype alignment approach and develop an implementation guidance to accompany that can help the users adopt and apply the strategies within quarterly consultations. So in concluding this presentation, at the end of the study, we would have developed and tested a novel alignment approach with some accompanying implementation guidance that can enable the Virginia Office of New Americans, the State Refugee Coordinator, and other VCCI representatives that represent the different systems to make the changes needed. I think by engaging the very adopters of the approach into this work as part of the advisory panel, that brings a value proposition that's quite strong for adoption and buy-in. But I think by far the greatest contribution we hope to make is really bringing in the voice and participation of refugees in these spaces. So to summarize, by aligning the different systems that are involved in refugee resettlement and by bringing in the community voice into quarterly consultations, this project can help shift processes that achieve systems alignment in a manner that can address structural barriers to resettlement, enabling the important resettlement efforts that are conducted by representatives in quarterly consultations. And with that, we are at the end of our presentation. These are a few selected references relevant to what we presented. I hope you enjoyed learning more about our work through this presentation. If you have any questions, please drop them in the chat. We will get to them after the commentary. And with that, I'll turn it over to our wonderful project partner, Susanna Lepley.
Hello, everyone. I am Susanna Lepley again. I've been working in the Shenandoah Valley for 25 years, the beautiful Shenandoah Valley, with leading nonprofits that have served immigrants and refugees. I've participated in some research projects previously, and also some writing projects. I've co-authored a chapter in a social work textbook, a master's level social work textbook on transmigration, as well as a couple of health related co-authored articles as well. In terms of commentary, just to sort of let you know, the refugee resettlement is broken into two stages. The first stage is 90 days, the first 90 days after arrival, and the second is up to 5 years after arrival. So the executive order mentioned in the invitation references the first stage, and there are a lot of refugees in communities around the country who qualify for services through 5 years. So that would be 2029 or 2030, depending on when folks came. So even if no new refugees enter the country, we're pivoting to how can we continue to provide services for folks as long as they need it. Pivoting to the research, we definitely, I think one of the biggest things we've learned from this is how that refugees need to be invited into the quarterly consultation space. We hire a lot of refugees, and they often do reporting on their programs, but I think we can invite them to speak about the things, the structural barriers that they face and that people in their communities face. Historically, there has been issues around meeting timing because the meetings almost have to occur during the day, and refugees often have historically not been able to participate in that because of the timing. They often work other jobs during the day. So we're looking for ways to both compensate them for participation, as well as understanding that now refugees, since we've been in the community since 1988, many refugees have moved into professional jobs professional positions where they could participate as part of their jobs. In terms of structural barriers, just to explain a little bit of what you have seen on some slides, housing is very expensive. For new arrivals, we're given very little money, and then we're traditionally not given a little bit of money for the first 90 days. Each person gets about $1,300 each person who comes to cover all of their expenses. And then that second, after 90 days, they're not provided any very, very, very little. Housing is very expensive. As you know, in the last 5 years, it's basically doubled. So also certain laws make it very challenging for refugees policies of certain landlords. So we often have people who are landlords who require between double and quadruple the rent in income. So if you're paying $1,200 for rent, you need double that up to quadruple that in income to prove that you can pay for it. Also, many require previous landlord references, which, as you can imagine, somebody coming from the country wouldn't be able to provide. And then also a background check or a reference check, which also refugees, in the way that landlords pull them, would not be available for refugees. The other thing that is a structural barrier for in Virginia particularly is that there are no limits to the amount of rent, the amount that landlords can increase the rent year to year. So they could increase it by 25%, they could increase it by 50%, they can double it if they want to. And there's so few vacancies. There's only about 5% vacancies in our community. So there's a lot of challenges in that way. The other big challenge is with benefits. So refugees qualify for benefits from the Department of Social Services. And we run into trouble at the intersection of Social Security benefits, enrollment in school, and medical care. So enrollment in school often requires a physical, but we can't get medical care for new arrivals for sometimes 2 to 3 months. And then if you don't have that physical and aren't enrolled in school, then your cash assistance benefits will expire and you have to apply again. And so there's this morass of trying to figure out what to do about that. And then how am I doing on time, Maliha?
Oh, I think you're doing great, Susanna. We have plenty of time.
Okay. And then we also deal with short-term self-sufficiency versus durable self-sufficiency or long-term self-sufficiency and integration. Refugees are pushed to get jobs by the system within 90 days to cover all of their expenses because of that really small amount of money that they get when they come in. So if refugees would be allowed to have a little bit more time to learn English, to focus on English, to focus on education, they would be able to get a lot better jobs because often people come in with a lot higher degrees, doctors, lawyers, not everybody, but a lot of them come in with administrative experience, banking experience, medical, all kinds of professional degrees. And if there was a little bit more opportunity, they would both be able to provide, they would have better integration, and they would also provide, there's gaps in our, in this country in healthcare professionals, in a variety of professionals, and they'd be able to contribute more to the economy as well. There is little to no encouragement from the refugee resettlement system to include refugee leaders or community-based organizations. There's also not a lot of flexibility in resettlement requirements. So also we have a lot of requirements from the federal government in terms of forms and how we manage money. Of course, we want to handle federal dollars responsibly. But sometimes CBOs don't have that same level of experience in how to manage funds. So there's not a lot of funding from the federal government to bring CBOs up to the standards that they need to be. And then resettlement agencies for that first 90 days are paid not by the number of people that we need to hire. They're paid by the number of people who come in. And the system for new arrivals is chosen by the president. So the number of people who come in is chosen. The number of new people who come in is chosen by solely by the executive branch. And that is my. Did I miss anything, Malia?
I think you did great, Susanna. That was a really in-depth commentary. I'm gonna switch it back to Carrington. We can open it up to Q&A.
Thank you. Thank you, Malia, for and Danielle for presenting on the work, and for Susanna for that great commentary. I think that was really insightful. So that brings us to our Q&A portion. So if anyone has any questions, please feel free to put them into the Q&A box at the bottom of the screen. I see that we have a couple that have been asked, but we certainly have plenty of time. So if you have a question, big or small, please put it in there. All right, I'm going to move to our first question from Nasser, which is, what English language training do resettlement agencies in Virginia provide to refugees? When are they provided? Are they during the day or over the weekend? And are the training programs free for refugees?
So we do it a little bit different in the Shenandoah Valley in Harrisonburg, which is about 2 hours west of DC. We have an intensive English program that we can participate at a local university. So folks get 3 hours of English classes. We have funding right now to pay for that, but that is going away. Other than that, so it takes about, I believe, 6,000 hours to become fluent in English of instruction. And so most of the other training programs are around 2 to 3 hours a week. They're usually very, very low cost. And so different resettlement agencies, some of them do it in-house, some of them refer into the community. We primarily refer into the community with a bridge program that costs nothing because the enrollment for those English classes, sorry, I feel like I'm jumping around. The enrollment for those English classes are on the semester. So we have a bridge program that people can participate in. It becomes a lot more challenging for folks to participate after they get a job because as the jobs are usually difficult and taxing, and so they don't have a lot of energy. We found historically they don't have a lot of energy for participation in in-person English classes. I think that answers it.
Great. And did I hear you correctly that you said that there was funding for it, but that funding is going away for providing those types of services?
Mm-hmm.
Yeah. And where does that funding typically come from?
There's the funding is pretty challenging to describe. It took me about a year to figure it out. So the funding for those English classes comes from Health and Human Services through the Office of Refugee Resettlement, Children and Family Services. Also, if folks are, for those intense English classes, those are a couple of $1,000s a semester. The other ones are usually like $30 a semester or something like that. So a lot less expensive and a lot more affordable long-term for refugees.
Yeah. Okay. Thank you.
Mm-hmm.
Yeah, and I'd like to just add to that in addition to the services provided through resettlement agencies and the federal funding, there are lots of not-for-profit organizations that do provide these trainings for free. So there are other resources in the community. Local libraries offer some sort of volunteer. They have volunteers that provide those types of supports. And there are also lots of community-based organizations that kind of fill in the gaps.
Thank you, Malia. I think you bring that sort of round circle because it speaks to the importance of these cross-sector partnerships. And it sounds like the program has lots of partnerships with organizations on the ground that do that type of work. So you can easily make those connections and send people to the services that they need. Okay, Nasser's next question, I hope I'm saying your name correctly, is a big one, and I'm wondering how much you want to say, but I'm going to go ahead and ask it and give you full reign to say whatever you do or do not want to speak to. But how would the funding for resettlement agencies be impacted with this new and unfortunate executive order?
Again, the executive order has to do with the first 90 days, so it is significant in that the funding will directly impact new arrivals. I think it also impacts the people who can't come as well. So the people who can't be brought to safety. It's going to, so we have a certain number of people who qualify for services now, but if there's no new people coming in, folks are aging out. So it'll affect that first 90 days, and then it will gradually, increasingly, if it's not started up, affect funding as the eligible population decreases.
Is there anything else, Malia, that you want to add, or?
Just wanted to add some perspective on this work that we are engaged in with the Systems for Action grant. Recognizing that there are, thousands of refugees that are already here, that are on their resettlement journey, and they need essential services and supports, and that system is intact. Those private-public partnerships through federal, state and local government and resettlement agencies and community-based organizations, these are intact. They're still there, but I guess my thought went to how much more important it is to strengthen these partnerships at this time. And maybe this is a time where people recognize, I don't want to use this very lightly, but a silver lining, like where is the room to strengthen systems alignment, to do more with what little we have and figure out, new procedures or processes for addressing barriers in a more effective manner. So I just wanted to drop that perspective that the existing ORR programs are still running. There's still a greater need for systems alignment at this time.
People still care and want to do the work. And I think you bring up a really good point, and perhaps it's time to have those sort of harder conversations as the funding streams do run out about like where can we supplement funding that isn't from the government to sustain these types of cross-sector partnerships and initiatives, which is not an easy conversation to have. Let's see, Nasser is following up on this question that we're discussing right now. I thought resettlement agencies receive funding per case, and half of that funding will be allocated to refugees' needs, and the other half will be used for caseworker support. So if we do not get more refugees coming in, how would resettlement agencies support their staff?
You're correct, Nasser, in that the first 90 days, it is this way. So the funding comes from the State Department, right? So through PRM, and half of it goes to caseworker support, and half of it goes to the clients. So I think actually more than half of it goes to clients right now. But that 91 days through 5 years is funded through Health and Human Services. And so as long as we continue to have people who qualify, we'll continue to get support. That has stayed pretty, there was significant influx of funding because of the Afghan evacuation. So that is going away at the end of this at the end of September. We are looking at a significant funding decrease, but there will be there should be continued funding because folks are eligible for services for up to 5 years.
Thank you.
And to reiterate what Maliha said, community-based organizations and refugees who have been in the community, helping out new neighbors and refugee resettlement agencies have always been instrumental in the services we provide. And so we'll continue to rely on CBOs as well as other volunteers in the community.
Thank you, Susanna. Can we move on to our next question, which appears to be the last one for now. So again, I'm going to urge anyone that has questions to go ahead and put them into the Q&A box. This question is, housing alone can eat up all of the income of refugees. At the same time, their limited income could hinder their access to safety net programs. I wonder if you have any suggestions for potential solutions.
That's a really great question, and that's actually what we're scratching our heads about, which is this is exactly the type of catch-22 situations that refugees face and have been facing for years. And this is also something that resettlement agencies and their staff are grappling with. These are the types of conversations we hear at VCCI meetings. So I hope that some of the alignment strategies, it's about getting the right people in the room. So basically, when we are thinking about how we can improve systems alignment in VCCI meetings, part of this is who needs to be there, who has the influence, and where do we start on the local level of bringing in the right people who have access to the policy levers, the practices and procedures that can maybe influence the way rent limits are set, or influence how landlords kind of work with refugees when we're trying to find housing for them. So I think that's exactly what we have to wait and see if the alignment approach that we develop can end up creating that ecosystem for designing or identifying those solutions. Thanks for the question.
Thank you, Malia. Okay, I don't see any other questions, but I'm going to take a moment to ask one that I'm just curious about, and you may or may not be able to speak to this, but for all of the different refugee resettlement sort of partnerships across the country, because I know you're focused on Virginia, like what is the variability like in those partnerships and in these quarterly consultation meetings? Do you have a finger on the pulse of how it's going across the country?
Great question. And we have observed a lot of variability in multiple ways. And I'll invite Danielle to also kind of chime in because she's really close to the data. But I think in terms of the urban and rural settings, it's just the way the variation ranges from how those meetings are set up, in the cadence of those meetings, in the way people interact. They either know each other or they're like in a room and there's they're still very early on in their alignment process. Some locations are more smaller, and so we see them to be a very close-knit group who is already aware of the existing programs, whereas other locations there's so much happening. There's just they have a lot more, they invest a lot more time to provide those sorts of updates. Some of the the discussions that we've kind of observed on the types of problems that refugees are facing, that kind of leads to really interesting troubleshooting, sharing of resources. So there is quite a lot of variation. Danielle, is there anything you'd like to add?
Thanks, Maliha. Yeah, I would echo everything Maliha said, and really that variation in like urban versus rural. We've spoken to Susanna even on the advisory board panel, and hearing that those close-knit communities, they are convening on these meetings, but also meeting outside of the meetings regularly. But for those larger communities, they do really rely on the meetings to give updates and connect with each other on a quarterly basis.
Wonderful. Thank you so much for indulging my curiosity. And it sounds like there's a mechanism in place for sort of connecting with other regions and reporting out on lessons learned and successes and what's working and what's not working, which I realize may not be the same for every different consultation meeting that's happening, because it sounds like there's a lot of variability with the rural and urban and just different types of partnerships and organizations that are there and involved. But thank you. One last question that I'm going to ask before we move on to a few announcements that we have is, you had a slide where you were discussing your next steps in this particular pilot project that you have with Systems for Action, but just curious if you have anything to say long term about what you hope happens after this project.
That's a great question, Carrington. So I think this is a small step for a larger work in store. The state of Virginia has in place, as a result of a lot of policies and legislation that was passed that was really supporting diversity, equity, and inclusion, and advancements of health equity in place that are existing in, at least on the state level and perhaps also on the local level. So there are lots of similar things happening in different parts of the state. And what we hope is, how can we embed quarterly consultations among all of those different initiatives, or use the quarterly consultation space to better connect these parallel initiatives so that there's more strength and there's greater collective impact. So Virginia has, I think, over 5,000 refugees, and they have a really strong network of community-based organizations and resettlement agencies. But it could look very different in a different state. So we want to test out this approach, and we would love to kind of share it with other states and other quarterly consultation processes, such as connecting with state refugee coordinators in other states, and hearing their reactions about, would something like this work for you? What wouldn't work? One of the things that we tried doing in this really small developmental study is try to do a sneak peek at what quarterly consultations look like in North Carolina and Maryland, which are neighboring states, to kind of see, like, are there ideas or suggestions, or things that we can borrow from how they run their meetings or how they're trying to better align. It's refreshing to kind of hear the interest. Refugee resettlement is not, it doesn't follow public health principles, right? But when we started looking at this closely, we're like, it really affects refugee health and well-being, and refugees are at risk for a lot of the public health issues, where we are trying to address health inequities. So eventually this will become a public health problem if refugee resettlement doesn't do its work really well. So we're invested in kind of, again, it's like the prevention imperative, right? It's the lens we wear as public health practitioners, that how can we prevent a greater crises in the longer run. So I'm hoping, that's where this work can lead us.
Absolutely. Beautiful response. Thank you. I know I put you on the spot there with asking that, and we're excited to learn alongside with you and support you however we can as the National Program Office. And I said that was the last question, but we actually had one more come in. So if you don't mind, I'm going to go ahead and ask that one as well, and then I think we can wrap up with announcements. This question came in from Corona. What are some findings around police departments trying or not trying to align?
It's a good question. So thus far from our findings, we've heard this. So there are certain requirements that are put forward for who should attend quarterly consultations, and public safety is one of the required entities. We've seen some variation in their engagement on VCCI meetings, again, depending on the strength of the relationships, depending on the outreach, depending on other factors that we may not be aware of for their presence or absence. So I don't think we have established findings on if they are or not trying to align. We know there's a desire and a need to have them on board. I think this is something that we can dig into more with our advisory panelists on their individual experiences. or any success stories that they've kind of witnessed over time in VCCI. I mean, we heard from the quarterly consultation in Fredericksburg, a lot of success that they had in engaging their public safety. It's a great question. I want to see if Susanna, you want to comment, since I've just entered this space. You've been here much longer.
I think it's I mean, I guess this is a structural barrier, a structural issue as well. I think it's we have in a rural setting, if we have something we need to reach out to the law enforcement about or public safety about, we just call them on the phone. They're like a block from our office, so we can walk down there too. And so I think when people are very, very busy, and we've already spoken to them about all of the issues that we have, or that they call us about the issues they have, one more meeting feels very daunting. And so it's a challenge for them to come to in their busy time. So it makes it more imperative that we, as a resettlement agency, figure out how to make the consultations more engaging for everybody.
Thank you, Susanna and Maliha. Okay, I think that's it for questions. Malia, I think you're still driving the slides, so can I ask you to, yes, there we go. So if you are interested in receiving a certificate of completion for attending today's Research in Progress webinar, there should be a survey that pops up right after we end today, and you can just fill out a few questions, and then Sadina will send you a certificate of completion in a timely manner. Next slide. We do have another webinar today. It's an informational webinar about the call for proposals, the new funding opportunity that I mentioned at the top of the hour that we just released last week. So if you're interested in attending today, you can go to our website and register for that webinar, or Sadina actually just put the registration link in the chat, which is great. Thank you, Sadina. And then next slide, please. And as I mentioned, also at the top of the hour today, this is an ongoing webinar series. This was the American Institute for Research's first time presenting in the series. They will come back and present throughout their project, so you can stay up to date as they learn more, and we will keep you updated on when their next Research in Progress webinar is. But we do have another one coming up in February from one of our past Systems for Action grantees. That was probably in the first cohort we had back in 2016. And Dr. Mariana Chilton is going to come and present sort of a retrospective presentation on her Systems for Action research project and sort of the trials and errors and what unfolded after her Systems for Action funding was over and the sustainability of that systems alignment initiative that she had. So that will be a very interesting one. We will include a link to register if you're interested in the follow-up email that we send that also has the PDF and recording from today. I think that's it for announcements. Malia, can you go to the next slide? I think this is an acknowledgement slide. Yes, so we'd like to acknowledge the Robert Wood Johnson Foundation and huge thanks for all of their funding and support that they provide us to operate as National Program Office. And I think that brings us to the end of today's webinar. I am so thankful that you all joined today to hear about this project, and thank you so much to the research team and community partners for coming and talking about it. It's a really important topic, and we're excited to learn more alongside with you. I hope everyone has a wonderful rest of their Wednesday.